How reassuring can a health screen really be?
I think the vast majority of health screens have a focus that looks at, is there anything wrong now? And even within that framework, there's superficial and depth. I think one of the biggest misconceptions that we feel and we see is that people think, I'm going to go into a total body MRI and everything is going to be checked. And I find that hugely misleading and falsely reassuring. Because first of all, on an MRI, you're only going to really be able to see what is visible already and what is bigger than, in the main, a centimeter big. And secondly, you're only looking at a structure. For example, if I would put a dead person in an MRI, it's going to look normal, okay? Because I'm going to see a heart, I'm going to see a liver, I'm going to see a kidney, I'm going to see bones, and I'm going to see muscle. So that if I'm going to say this person's normal because the MRI is normal, okay, that clearly doesn't make any sense. And I'm exaggerating now to make a point. Of course, there's value in MRI, but not as a sole screening tool, because you're not looking at functionality. So when I think of a health screen or health evaluation, as we call it, that looks at all those different areas, as in, is there anything wrong now with this person, in all the depths that we can measure. So not just as looking at an image, you're looking at the functionality and you're looking at the purpose of that organ.
And the performance.
And the performance in its totality, like spot on. But then you also want to look as in, what is this person likely, in which direction are they moving, to be able to prevent problems in the medium and long term. And then a massive part, what I think of an evaluation should be, is when we look at performance, as in how well can I feel? And that is very different to my MRI is normal, but I can feel tired. Okay, so how useful is my MRI if I'm actually feeling tired and they say, well, actually your spleen, your pancreas, your liver, all this looks fine, but I'm still feeling tired.
And that's a big reason as to why a lot of people come to see us, isn't it? Because it's the fatigue, it's the poor sleep, it's the anxiety, it's the skin issues, it's the digestive complaints, it's the pain. And you can have a completely normal MRI and still have all 6 of those problems, which then tells you clearly those aren't structural, those are functional, and there must be something else that's causing those symptoms, because there's no symptom that just arises for no reason. So then you need to look into that functionality. And often, aside from, yes, a well-designed screen can have value, most people, if they're potentially younger, are less interested about the future long-term diseases, and they want cognitive performance day in, day out. They want optimal energy, they want good libido, they want digestive system that isn't causing them embarrassment or pain. So we need to look into the functionality, and we need to choose the right diagnostics and functional testing to be able to monitor that, track it, and then also intervene so that you can work out whether a strategy is being effective or if it needs changing.
Exactly. And it all depends on what you're looking at. And it's very similar with health. They say, in which direction do you want to look? Because to be able to see, actually, do I have a 360-degree view of this person on how they are now, what their likelihood is of illnesses and disabilities in the future, and how they are performing. And unless we actually look at all 3, you have a very limited evaluation of your health, and you're going to be missing crucial bits. Okay. Otherwise, the vast majority of health assessments are a tick box exercise. Okay, we look for that, it's there or it's not there, and that's what it is, okay? If you happen to have a problem that is outside the tick boxes that they're looking for, just too bad, okay? You might get a clean bill of health because they actually haven't looked at your problem, and that's what we see so often, people coming in and they've had a health assessment or 2 or 3 even, and they've had loads of blood tests and say, I've got a clean bill of health, and yet I actually feel the way I do, and that's not acceptable.
And that's even before we get into the prevention. If we're looking at then genomics and genetics, and we've got almost that crystal ball to look into the future to say this is where you're at risk for, that's not about the now, that's about the future, that's about the prevention.
I think there's a big difference between identifying a problem and trying to prevent a problem. And unless we're going to have both within your assessment, you're going to miss it. And the vast majority of assessments actually try to identify a problem that is already there.
Undeniably, screening offers value for your current health, but where the real benefit is when we focus on prevention and performance, because that's transformative for future health.